Okay. Testing, 1, 2, and 3. Hello? Hopefully everything is working. Yep, okay. My Siri bot has now turned off shield mode from the room. I am going to be starting in a little bit. I'm just making sure like all my prep is done, etc, etc. I know I'm a little bit early. This is new. This is new to me. I'm not used to being early. Why am I early? Well, really the reason why I'm early is because I haven't slept yet. Because sleeping is hard. I haven't slept yet because I don't know what was going on. But yeah, so there's that. I don't know. I was trying to get to sleep, like dead ass. It just wasn't really working, so I was like, screw it, I'm gonna be a little bit early. So, obviously, this is what this is. And ad starts in like 54 seconds, so. Hi. Hello. We're gonna be yapping about like just a lot of things, really. So we're gonna go over, well, there's some new things I have to go over for tomorrow. But we also have some stuff to go over, like reviewing from today. So we're gonna be yapping about a lot of that today. Unfortunately, I can't really show any of this on picture. Oh shit! Thank you for the reminder. Did it work? I need to turn off the throwables for like 2 seconds. Come on, thrones. Wait, test. Okay. That means that works. But yeah, I don't know why I haven't been able to sleep yet. So today is just gonna be really fucking weird. It's gonna be an all-nighter type of day. Like, I'm gonna all-nighter for tomorrow, which is not healthy. And I would not recommend that ever for anybody else. However, I can't really avoid it. So, what else can I do? But also, oh my god, the stream streak is crazy. Thank you. Deadass. Oh my god, Oomfies are streaming. Oomfies are chatting. One moment. Wait. Oh my god. Discord. Hello.
My project I made. So.
Hello.
Hey.
How are you doing?
I have to finish my project by midnight.
Oh god. What time was it over there? It's like what?
It's 9 a.m.
9 a.m.? Oh yeah, it's doable. It's doable. I don't know why, but girl,
yeah, so.
I haven't been able to sleep yet.
Oh girl, what?
I don't know why. Don't ask me why. I don't know. Don't ask me. I was trying to sleep.
How much caffeine have you consumed?
Not enough.
What does that mean? You can't go to sleep.
I mean, yeah, I can't go to sleep, but like, hey, I'm not intestinal. Hi up, my god. My god, I'm not intestinal. But no, I mean, so, okay. In fairness, I did drink some caffeine today. Like, so, the Celsius, right? The fucking, like, fitness packets.
Yeah, isn't that like all you guys have over there?
Yeah. That is all I have over here. So, I may have... What the fuck? I'm not even testicular! Not my name.
Debatable.
I don't look like a ball, dude.
No, but you have balls.
Fair enough. I have eyeballs, yes.
Well, I more meant like the testicular type, but yes.
I mean, technically we all do because like all of our
I mean,
parts.
like, yeah.
Yeah,
Yeah.
like we can all kind of have balls. But we do.
I wonder about that guy. That's the one thing I hate about the Ask Doctor subreddit is that when people come in,
Mm.
not a lot of them come for follow-ups. I really want to know what happened to that
Yeah,
guy
it's Adi Maddie.
with the tunneling testicular.
Yeah, girl, I don't know how to think about that either. I wish I knew because I do not.
Well, like, and here's my thing. Like, technically, I know we're sitting here and we're calling it like because he said, "Oh, I have this injury to my ball." Isn't it? If I'm remembering my 7th grade health class,
Yes.
isn't that technically like it's on the outside? I mean, and I know it's tunneling, so now it's definitely ball involved. But like,
Yes.
isn't the testy the part on the inside, like the actual ball in the sac, and the sac is the scrotum? So technically, he has a
Yes.
scrotum injury.
Yes.
Okay.
Yeah. You got it.
And he wants to hope that it just stays a fucking scrotum injury. And
I mean, bitch, it's already tunneling. It's already tunneling. What does he want?
Well, he wanted to pretend that the gray discoloration was normal too. So.
I mean, obviously it's not.
Well, he said it's just from riding his bicycle. To
Well-
which I say, if your dick and your balls look like no, I'm just gonna go out here and say that
You're
if
right,
your-
though. That's the
If
problem.
your ball sack starts to look like snake scales and turn gray
Snake
because of how, yeah, dude, it was literally lumpy. Like it literally looked like he had.
And also, Chris, this is normal.
Yeah, like, so if he literally was like, oh no, that's just from riding my bike. If that happens to your genitals, like, I have to imagine that also comes with reduced sensation that you probably
Yeah.
don't want down there.
Yes.
So, like, I would just.
Your balls go
highly
numb after a while of cycling.
Yeah, I would just highly recommend, like, trying out some different methods of, like, anti-chafe, more ball protection,
Right.
you know?
Right. You're right.
I do not have a ball sack personally, but I'm just saying that if I did have a ball sack,
I would take care of it.
yes.
Mm-hmm.
Yes.
Mm-hmm. Mm-hmm.
So,
Yeah, no, I completely agree. I mean, we could go over, like, the parts of the ball sack today, because, I mean, I am reviewing everything from both today and yesterday, like, so, because in Patho today, we went over, like, the female genital system, and then we also went over the
females
male
don't have
genital
genitals.
system.
Females
Well-
don't have genitals. So,
I mean, we do. We just have internal ones. Where? It's not like they're fucking Barbie dolls. What? Or Ken dolls? Right, yeah. What level of sorcery? What? Sorcery is it to get scales on sack? The case that we saw on Reddit. Sucho, why are you calling me Unk? I'm not that old. I'm not that old. You can start calling me Unk when I'm 30. I'm not 30 yet, dude. Damn. I'm not even that old. I'm not even that old. What the fuck, guys? What the hell? How dare you? How fucking dare you? But yeah, so I can't really show any of what I'm going to be talking about on screen, obviously. Or else Twitch is gonna, everything's gonna like, hit me with everything. So I'm not gonna do that, obviously. So, do you want to hear about ball? Ah! High up. My god, dude, how dare you? My god. Tita! You know what? At least it's not Lola. I mean, I didn't get any sleep. So, oh my god, it's not even my fucking birthday yet. I'm not even 30. I'm not even 30 yet, dude. Guys, the fuck? Crazy. Y'all are insane. I haven't even like woken up with back pain because I haven't even gone to sleep yet.
Okay, so
I don't know T-Rex. I don't know T-Rexes.
Okay, so it's anaerobic.
Yeah, yeah, I can send you like this sketchy picture. Sketchy.com. I can go to the sketchy unit on C. diff because it'll like quickly explain everything.
C. diff your mom. What?
Ah. I mean, she do be seeing the different. No.
Wait, no, I'm very confused. I thought you're. Wait, no, now I can't remember. I just know that everyone in your fucking family is a fucking physician. Is
Yes.
it someone a dermatologist? Someone
My mother
a
is.
plastic surgeon?
My
Okay,
mother
okay,
is.
that's what I was gonna
My
say.
uncle's a plastic surgeon.
Can't remember what your dad does besides doctor.
Anesthesia. He also he quit his surgery residency to like follow my mom to the States, and then he got an anesthesia residency.
Fancy.
Also, no, I do not allow that. I am not that old. Oh my god, guys, I'm literally not that fucking old. I am not that old. Stop calling me Unk.
Oxygen.
I'm gonna crash out right the fuck now. Why are you guys doing this? I'm not even that old. Wait, like 1 moment. I can like get you this screenshot of C. diff. This is honestly the worst bacteria picture that I've ever seen, honestly. But like, so I'm gonna screenshot this and then send it to you. My god, I'm not even that old. Guys, what the fuck? I'm literally not even that old. I haven't even gotten to like the ball talk part yet. Y'all are just putting words together and then making no longer words. You guys are not even making words anymore. You're putting letters together. What is this? What is this? But yeah. No. What the fuck? I do not. What? My god. Guys, I'm literally not that old. Fucking hell. No. I'm literally not even going bald. Holy shit. Girl, what the fuck? I'm not even that old. What the hell?
Sure.
I'm literally not. I'm literally not. What the fuck? What do you mean cope? Okay, wait. That was a really good segue. So you know what? It works out. But fuck. That works out. Absolutely. Okay. But so basically, if you want to look at C. diff, holy shit, shiny headband is insane. I'm gonna take away the bald toggle from you guys. But okay, so C. diff is a gram-positive bacillus. Gram-positive bacillus. It's an obligate anaerobe, and it forms spores. And both the toxic form and the non-toxic form, the one that makes toxins, can colonize the gut as a part of like its normal like flora. C. diff is going to be transmitted via the fecal oral route, so poop mouth, specifically through the
My favorite.
We love poop mouth. We love poop mouth transmission because it never changes. It's always poop mouth. Regardless of what is in poop, it is poop mouth transmission. It's specifically through the ingestion of bacterial spores. Hi, Princeps. Welcome in. I'm gonna yap at Maddie about C. diff for 2 seconds before I get into the conversation about balls.
I can't believe I have to actually write fecal oral route on this fucking PowerPoint.
You're never gonna be free of it. You're talking about C. diff. C. diff is poop mouth. Poop mouth route. It's always poop mouth.
Blech.
Yep. Yes, ball knowledge, because I do know ball. So basically the reason why C. diff can survive the stomach is because a lot of things that are going to be happening in the stomach that will cause like the thing to colonize. So basically, like for example, if you kill everything else in your bowels, kill everything else in the stomach, like using like a shit ton of...
isn't that why C. diff usually only is able to thrive when you're on fucking antibiotics? Because normally it just stomach acid go...
I mean, yeah, basically.
Your body just... But then when stuff's all fucky and we kill off the good gut microbiome, then it's like, I'm C. diff.
Yes, basically.
You're gonna shit your brains out.
Basically. I mean, it's natural Ozempic, am I right? I'm joking. Do not do this. Do not do this.
How do you feel this? Okay, how do you feel about that guy, Chubby Emu?
I love Chubby Emu.
Okay, because like I was watching some of his videos and I very much felt like he was kind of twisting shit in order to sensationalize it.
I mean...
Or, like, I felt like also some of his medical opinions, like, he started this video and was like, listen, if you need chiropractic care, go to a chiropractor. And I was like, no!
I mean... No! I don't agree with everything, but his videos are very good at, like, being... It's very memorable.
Yeah, they're memorable.
Yes.
But, like, I felt like a lot of some of what he said, I was just kind of like, there was this one patient he was talking about, it really rubbed me the wrong way. How
ancestral anomaly? What the fuck, guys? How dare you?
He was talking about this patient, and sometimes I feel like he kind of loses. These people are humans.
Yes,
and they're people, and we need to have, if not respect, then like delicacy and some courtesy.
Right.
If not for them as people, because then for their struggle and their family. And
Princeps has it right, by the way. Like, I am just a little guy.
The case that really kind of bothered me was this woman who he went into like, what happened to her before, the story he was actually talking about, which is like, yeah, we need some backstory.
Which case was this?
This was chiropractic, a woman did a self-chiropractic adjustment.
And yes. Yes, I remember.
And I kind of felt like the way he, not all of what he shared, I understand it may have been in the case report, but like not all of what he shared, in my opinion, either needed to be shared or needed to be shared in the way that it was.
Okay.
Because he specifically was talking a lot about how her parents... And understand, I'm being way more delicate about it than he was.
Oh, I know.
Her parents neglected her. And so she was not taught any part of basic hygiene until she happened to go to the doctor when she was like a young teenager, and he noticed like a stench, and he taught her how to use toilet paper. Like, so none of this at all related to the fact that this lady, as a young adult, did a self-chiropractic adjustment and caused an arterial bleed.
Yeah.
You know what I mean?
Yes.
None of it relates to it, but he's sensationalizing her as this kind of disgusting slob that developed all of these health conditions and had chronic UTIs because she's so disgusting. And I felt like it was like kind of a prime example of why, like the kind of attitude that drives people away from actually getting help for this kind of shit.
No, I agree. I didn't know, but wait, is this a new...
I don't remember what the date was. I sort most content creators' videos by like most popular of all time.
Got it. Got it.
And then it really rubbed me the wrong way because, like I said, I understand it may have been in the case report, but all he really needed to say was either, hey, she was neglected as a child and wasn't taught proper hygiene, so she had chronic health issues because of this, and then because of her chronic health issues, when she started developing chronic headaches, she became really frustrated because she, you know, was always in and out of hospitals, and that led her to turn to alternative practice.
Right.
You know what I mean? That's all he needed to say. He didn't need to sensationalize her into this disgusting person. Because I felt like at the end of the day, it was disrespectful.
I mean, I feel like that's what I notice nowadays when I look at his more recent videos versus like the older videos, because like his older videos didn't have this. Like,
yeah, and then I also don't like, he introduces himself, and I did look at this, I was aware of this. He's not a fucking doctor.
Yeah, no, he's not.
He's a fucking pharmacist.
I mean, he's a pharmacy. He has a doctorate in it, but yes, no, I agree.
Yeah. And so like when you sit there and you're introducing yourself on medical videos,
yeah,
it gives me the same taste in my mouth as when nurse practitioners are in a hospital and they introduce themselves as Dr. Bob.
I mean, girl, I'm gonna tell you, did you know I didn't know that he wasn't a doctor until like I looked more into his credentials?
Right. Okay,
yeah.
Well, so according to his wiki, he's a pharmacist.
Yes, he's a pharmacist. Also,
he's a
hi, Benny.
Pharmacist and a toxicologist.
Yes. And like, I like his content when he sticks to those things, like the original cases, like the methylmercury versus ethylmercury case, the gummy vitamins.
But even then, he's done a few gummy vitamins. That was the first one.
The 7 years ago one. That one was good.
Yeah, there was one that he did recently where I just kind of sat there and I was like, I literally sat there and was like, you're kind of a piece of shit. Because it was a specific, it was a kid, and the kid, well, there were two of them that that had to do with gummy vitamins that gave me a bad taste in my mouth. The first one was a family from out of the country. They came to America for a trip after the dad abandoned that family.
Right.
Okay? So the mom was trying to do like hey, like, it's okay. I still got you, kid. Let's go on a fun trip to America. And they spoke English as a second language, so their English was not great. And they weren't super clear, like, what kind of store they went in, but they went into a store to pick up some stuff. They saw a bottle of gummy vitamins, thought they were candy.
Yes, no, that's the same case we're talking about.
Right. And that one he handled basically fine. I felt like he kind of teetered on the edge sometime of falling into that, like, I can't remember the name of the actual fallacy. You know, that, like, stupid, savage, foreigner, you know, they don't know shit.
Yes.
You know, and, like, kind of a thing, but, like, it wasn't so bad that I, like, stopped watching, you know?
Right.
Then it was the other one where, listen, before I explain this one, I'm going to say, do not administer over-the-counter or prescription medication to someone else without their consent and knowledge. We don't drug people, okay?
Yeah.
It's bad.
Obviously.
But I didn't like how he demonized, there was this mother who the husband had ran out. She was dealing with their kid. I think he was like 9.
Mm-hmm.
And he just was a very energetic kid, and she was getting really fed up. And so basically she did a very bad, which was she swapped his gummy candy out for melatonin.
Yes, and that is not good.
Okay?
I agree.
We don't do that. That's very bad.
Yes.
However, how he spoke about her, like, was very much like, oh, this horrible single mother who just can't handle like, you know, the basics of motherhood. so she just has to drug her child to shut him up. And it was very much like, you don't have empathy or kindness or basic decency for a woman who's just been abandoned and is having to hold up an entire family unit with a child who is also potentially acting out because of the walkout of his father, who also might have underlying medical conditions. Like, we don't know what the fuck is going on with him. You know? Like, there's no support in the US for these kinds of situations.
And I mean, unfortunately, I just have to say, we know the reason why that this happens, right? This is because this is the kind of content that makes money nowadays. Like,
right.
Fucking Caleb Hammer. Caleb Hammer's a good example of like,
I used to like his content.
Same! I used to as well when he had good advice.
Because I felt like he had good advice, and even when he started doing like more of the sensationalist stuff,
I didn't like it.
I felt like, but in the beginning, I didn't love it, but I still felt like it was less about ragging on the person and more about like kind of a harsh reality check.
Right. Like there's a difference between that versus now.
Right. And I still felt like sometimes I was like, you know what? Like, yeah, he's a harsh reality check, but like he's but back then I still felt like he wasn't trying to be mean. You know, he was still helping people. And then now I'm just like, no, he's just a piece of shit. Did you see what he recently said about D'Angelo Wallace?
Girl, that's why I was thinking about him. That's literally why I was thinking about him.
Don't come for my non-binary black king.
Yes,
like,
we love D'Angelo.
Literally shut the fuck up. And he tried to like make it out like, oh, well, I thought D'Angelo was a woman and I wanted to get his pronouns right, so I Googled him. Oh my god, you did a basic human decency. Claps for you? Like, what the fuck?
But no, like, I agree with you. Especially, like, this is an example of, like, how nowadays content just kind of turns into this. Like, the content that makes money nowadays is this kind of sensationalist bullshit. And it's like, what the fuck is the point? Like, it's everything just turns into like this drama mongering, like weird ass shit. And I'm like, I don't like it. So I don't do that. Sure, it means I'm not going to make a lot of money when I do my content, but like, that's fine. I'll take that. Fuck whatever the fuck they're doing, right?
Well, I would just rather be able to sleep at night.
Yeah, exactly. I love having a conscience. And speaking of sleeping at night, you're not going to be sleeping at night once I talk to you guys about sexually transmitted infections.
Like what that guy probably has in his ball sack.
Probably. I still want to know like his sexual history as well. Like, I don't know why the fuck that happened to his balls.
No, listen, I'm not saying this to be mean.
No, I just want to know. There's no reason.
No, I know, but
we're not being
saying,
mean.
Like,
we're being educational.
There is no way that guy is having regular intercourse, because there's no way that a woman wouldn't have seen that and noticed it and made him get help before it became...
I mean, you don't know that. Some people really just don't look. Some people really just don't.
You're telling me that if you have your face in someone's padunk...
Maybe he's not into blowjobs.
The only man.
I know.
In the entire...
I mean, okay, there are a few.
Okay, one of 50 men.
1 of 50, yes. Maybe he's one of the 50.
Sure.
Who knows? Okay,
so hold on. I'm learning now.
Also have to check like where am I?
Parocolate is necessary for germination.
What are we talking about?
C. diff.
C. diff, which what? What part?
Parocolate.
Taro what?
It's a bile acid salt that supports C. difficile germination.
Let me see. I don't know which salt this is. What the fuck? How do you spell it?
TAUROCOLATE. CHOLATE.
Oh, taurocolic acid. Oh. Also, yeah, I will absolutely tell Twinkie, no ketamine. Well, I am not a doctor. Not yet.
Okay, listen, did you see that horrible sentence from my nursing program?
Yes.
Was I being harsh? Because
No.
that sentence...
No, you were not.
When I sat there and I put it in Psych and Server, and for even him to be like, what the fuck? I was literally sitting there, and I'm still, like, kind of throwing up a little bit in my mouth.
Yeah, I would too.
Because one, these people are expected to teach me about nursing, and they can't write a sentence. So, the sentence is, it is the student's responsibility to determine whether a physician or nurse practitioner or whether a medically prescribed drug may affect clinical performance.
Yeah. Yeah, honestly, that... Sometimes I speak faster than I think, and then I stumble over my words and I sound grammatically incorrect. But that I didn't know what that meant. Like, I know the gist of what that meant, but, like, those words did not make sense to me.
This is in the section about use of prescription medication. So, I have a few issues with this. So, I like the direction that this policy rewrite is going into, because the original policy in the handbook that I read over the summer for this same program before they updated it was written in a way where you would have to get, like, any prescription medication that you were prescribed, you had to get a letter from the prescribing doctor saying that it would not affect your clinical, like, your ability to be in clinical. And I was like, that's kind of an overreach, because the way that this is written, you really need me to go get a letter from my fucking birth control? You don't need me to get a letter from my birth control. You don't need me to get a letter from my omeprazole.
I mean,
you know,
yeah,
that's not what you're trying to catch here.
Yeah, they're not phrasing it. They're you know what they mean by how they're phrasing it.
Right. So I think that's part of why they rewrote it.
I would hope so.
What I think that they, well, first off, let's acknowledge it. This sentence is written so horrifically that it could be written to understand that, is my physician being impacted by my drugs?
I mean,
is my
hope not.
Because that's kind of how this reads.
It's giving it. I don't like that.
I don't like it either. And so then what I think they were trying to say is, it is the student's responsibility to determine, with the assistance of the prescribing physician or nurse practitioner, whether a medically prescribed drug may affect clinical performance.
I guess. I don't like it.
That's my best guess.
Yeah.
But I am also just going to throw out here, and I acknowledged in Psych and Server, I said, I know I'm just being petty and picking it apart, but they asked for it.
You're allowed to be petty and pick things apart.
What is a medically prescribed drug? What is the alternative? Are you...
recreational?
Is my doc... Yeah, but your doctor is not prescribing you fucking recreational meth.
You don't know. Maybe. I'm joking.
Right. But you know what I mean? Like they have a substance abuse policy. So you don't need to write this in a way to try to catch substance abuse.
Well, yeah, obviously.
Or if you really want to, you add a separate sentence and say, prescription medication must be taken in accordance to the directions given by, the prescribing physician. For more information, see section whatever the fuck, substance abuse policy.
Right.
You write that. There is no alternative to medically prescribed drugs in this context.
Yeah.
There's just no fucking alternative. Like, unless they're going to sit there and say, no, Maddie Latte, your birth control, sex is recreation, and you actually need to get a letter from your doctor saying you're not just using this for fucking. Like, unless...
Okay, and what's the problem if you were? Excuse me. Huh?
Oh, right, I know, but I'm just saying, like,
I know. I'm just being needlessly pedantic as well.
I'm like, you people can't write a sentence.
And
you think I trust you to...
Look, there's gonna be more people nowadays that also do not know how to write sentences. Unfortunately, this is the norm. Do I like that this is the norm? Fuck no. Unfortunately, this is just this is just life. This is just kind of life, dude. Not much else for me to say.
I saw a TikTok the other day. This nurse was like, POV, you're working with a nurse who passed the NCLEX
Okay.
with the help of ChatGPT.
Huh.
And I was like, what do you mean? What do you mean? And she was like, oh yeah, the nurse didn't know what NPO means. And I was like, please tell me this is a fucking skit. Please tell me this is a fucking skit.
Girl, I just don't understand like how you wouldn't know what NPO means when you...
I know what NPO means.
Bitch, I know what NPO means. Even I knew what NPO was before I was before I was in med school. Like, that's kind of obvious. Granted, I was also in Latin class, so like that's partially why. Because like that was something that we learned. We knew non per os, which is just none per mouth.
Yep.
Yeah, it's not hard.
Well, and here's the thing. You don't need to know the fucking Latin.
I know you don't need to know the Latin.
No one needs to know the fucking Latin. Just know,
and Japan, I agree.
No mouth. No mouth. And yes. I saw them say, oh, I didn't know if that was just food or if it was also meant. Then fucking clarify
mouth.
with fucking provider.
Nothing by mouth. Nothing by mouth.
Nothing by mouth.
Nothing by mouth. Nothing. None.
Well, I've seen some people be like, oh, nothing by mouth, but you give them their medication with like half a sip of water. And I'm like, okay,
it depends.
Then clarify with the fucking provider. If you want to know if
there's nothing wrong with asking questions.
Tylenol.
Yeah, you know there are no stupid questions. Except for like, what is non-per... Well, no. Even clarifying non-per...
Just Google NPO.
Yeah.
What does NPO mean?
And also Japan. What about a med student who graduated using ChatGPT? Like a lot of my classmates.
No, shut the fuck up.
I'm not even lying. That's the problem.
Auricolic acid is a bile acid.
Yes, it's a bile acid. It's a conjugated bile acid. Yeah, exactly, Japan. Why do you think I don't fucking like ChatGPT? I don't like ChatGPT. I do not like fucking... Why do you think I don't like using like any generative AI in my bullshit, dude? I don't like that. Because like even if you say that like I'm sorry. I'm going to get onto my little soapbox right now and say this. Even if you say that you're only using it to summarize things or you're using it to like make questions, at some point, even the presence of generative AI can make people like me, like you, question, did they really graduate? Do they really know what they're doing? Or were they just learning, quote unquote learning, whatever like the ChatGPT told them?
Right. And listen,
it breaks down sorry, can I yap for like 2 seconds though?
No, yeah, do it.
Because like for me, AI, like the use of generative AI and like learning and all that shit, it breaks down like, even in science, it breaks down like the main conceit that we know what we're talking about because we studied this. Like we earned it. It breaks that initial trust down, which is like the reason why we even have all this prestige around these degrees. And now you can continue.
Well, not so much nursing anymore. But...
Oh, yeah, exactly. Yeah. Like, You're just letting the fucking robot make the wrinkles for you. You need to make your wrinkles. You need to make your brain wrinkles. They can't do it for you. You can talk to people so that you can learn from them. I do that all the time. Like, I talk to other people. Like, I don't, like, the synthesis process is done by yapping with me. That's how I learn. Yes. Jeff, you see why I don't use it? You see why I don't like it? You're understanding. You're getting it. You're getting it. I mean, what if I told you that one of my friends, like, she was supposed to be in my year. She was supposed to be promoted to Wild 2 with us. What if I told you that one of her class members in her group, like, used it to plagiarize? They used it to plagiarize on an assignment, a group assignment, and that whole group got a 0 on that assignment, and that brought her grade down to literally not even a full point below passing, a decimal point below passing. And she retook that class. She's back in year 1.
So she's a med student.
She's my classmate. One of my classmates. She's also one of my best friends.
Well, not anymore. Or are we using classmate in the way that, like, oh yeah, this person was my classmate when I was an undergrad, but he was a grad student?
Yes.
Okay.
That way. Not like not my, like, year mate. Yeah. See, that's why I've seen people get burned by it. I do not like the use of it. I am not okay with that use. And that's why I'm very against it. I don't like that shit, you guys. Yeah, Jaffang, it's because they don't want... They'll just make up an answer and give it to you. So it's like, you can't vibe code using ChatGPT or like Claude or like any Gemini or any of these things, because the inherent flaws are still going to be there. A polished turd is still a gilded turd is just still shit. Exactly. You see it. You see my problems. You see why I don't like this. Hence why I just want this fucking bubble to end now. I want this bubble to go. I want it to fucking pop. And I want us to not use it anymore. And dude.
Only use that I have ever found of it, and even this is with a huge asterisk, is when I'm like struggling to grasp a math concept that I am teaching myself.
Oh, just use Desmos.
And it will break down the steps. But even then, it's just stealing something off of fucking like Chegg that some math teacher already did. Oh, you know what I mean?
Yeah.
Like some other person, like you can still get that off of like any other,
I go off of the Reddit.
Reddit, math tutoring, Khan Academy. Like it's just pulling it from there, so you don't.
There's like a math Substack or some shit, like that kind of website.
So that you don't have to like click the link. That's all it's doing. It's sheer laziness at that point. Because I like having the steps where I could, like, when I'm learning it, I like seeing someone else like do it, because then when I can see like where I fucked up, it's easier for me to not fuck up like that in the future.
Yes.
So I'm not even talking about cheating. I'm literally talking about when you're trying to understand the fucking concept.
Right.
And you're like, I have no idea where the fuck I went wrong.
Yeah, like, unfortunately, Jumping, I don't know how to help you when it's in cybersecurity. Like, freaking AI is baked in. Unfortunately, you're in the field. Yeah. You're in the field where it's like, the AI is in there. You can't really get it out. And, like, I don't know, man. okay, let's see what Vi said. So Vi said, would you say it's like a smartphone? The people who use it and make it depend. Yeah, I agree. So like, basically, it depends on how you use a tool. The caveat though is, at least with a phone, and you just use the phone without any of the AI bullshit, you're not like wasting 1 million tons of water for one prompt or one query.
Right. And I also think too many people kind of make the mistake. Here, we were talking about Chubby Emu, okay? He did another case where, again, didn't really like how he talked about this guy, because in my opinion, there was clearly like some science and medical misinformation that this guy fell for.
Right.
That he didn't say that there was anything diagnosed. I think it would have been in the case report, but like, this guy didn't seem to me, from what, you know, Chubby Emu shared, to be in the best state of mental health before all of this happened. You know, like, I think he, you know, was he potentially vulnerable? Was he potentially mentally ill? You know, and this is how he made these conclusions. So, hold on, I actually have to look up the Chubby Emu video now because I don't remember. Chubby Emu. So basically, this guy saw online salt bad for you. Yeah, an AI chatbot mistake led a man.
Yes, I remember that case. Yes.
Like, sodium chloride bad, and the way he was.
So he used like a different thing instead.
Yeah, it was sodium bromide.
Oh my god. And yes, Shadefire, I completely agree. We need to distinguish between like regular AI, so like non-generative, so like the analytical stuff, versus generative AI. Generative AI is the one I have beef with.
Right.
And also, I don't like how the generative. I don't like how generative AI has just kind of been taken over the term AI, to where everybody, if I say I used AI to make this thing, or like I use AI to like analyze this thing, they think I use like a generative AI process, but like no, I just use like whatever the fuck analytical thing is in like a program already. That's different.
Right.
But back to what you said.
Well, no. I just felt bad for this because this guy clearly, he wasn't trying to like hurt other people. You know what I mean? Like, he wasn't one of those dangerous misinformation people who you're kind of like, oh yeah, we have to help you because you're a person, but like you're hurting a lot of people. You know what I mean? Like, he just did this for himself. The only person he fucked up is himself. And the chatbot could not differentiate at an atomic level that yes, chloride and they're you know, the compounds are similar enough, you know, on the periodic table of elements.
Right.
It was like, yeah, that the answer he got back was not a medical answer. It was a scientific, you know, periodic table, you know, theoretical chemistry. You're sitting there smoking a blunt answer. No, but you know what I mean? Like,
yes.
This is the kind of shit that, like, you're literally passing around a blunt in someone's backyard, and you're like, man, hypothetically, what would happen? XYZ. You know what I mean?
Yeah.
Like, you're not actually doing it. You're talking about an interesting hypothetical with a bunch of other dorks. And not dorks derogatory. I'm including myself in the dork.
I mean,
but
we
like,
are dorks. This is the dork hours.
Right. So, like, I'm just saying, like, this man understandably did not have the education to sit there and go, oh wait, this is not actually what, you know, it is. This is not what's actually, you know, the thing. It's not talking about medically, it's talking about chemistry.
Yes.
You know? It's talking about, like, just literally textbook chemistry. He wasn't able to differentiate that, so he was putting it in his fucking food.
Yes.
And that's where I'm saying that's hurting him. like, I'm all for access to information, but like, it needs to be information that this poor guy cannot use it to potentially, he could have killed himself.
I mean, he was pretty close.
Yeah.
Like, unfortunately.
Well, right. So I'm just saying it makes me sad. And I think that there's a huge difference between people like to compare that, like those kinds of situations to, I saw a parent once post because they were upset because I don't even remember what fucking animal this was. Because
scared.
It was kind of a, they were mad. And listen, personally, I'm just saying that as like someone who wants to be in healthcare, I would have made a different decision about this next part. But I also don't disagree with this doctor. The doctor, you know, there's a fucking computer in the fucking room.
Yes.
So this guy, like, I'm trying to figure out how to word it. He needed to...
I mean, you can just say what it is. You don't have to, like, reword it or anything.
No. I'm trying to... I can't remember the fucking animal.
Ah.
He had to Google, like, because it was not a typical, like, North American fucking, skunk, cat, dog, coyote. Like, it wasn't a typical animal that you would typically see someone for a fucking bite. So he didn't know off the top of his fucking head if this animal was a potential vector for rabies. And so he had to Google it. And the mom was upset by the fact that he had to Google it. I'm not really upset. I don't expect my doctor to know if, like, the North American wildcat, where there are, like, I think it was like an otter or something. You know what I mean? Like, it was something that you're
it's
like, this dude is never gonna have another person in his fucking practice ever come in with a fucking another one of these bites.
Yeah, exactly.
You know what I mean? And here's my thing. I don't even care if it was a skunk or something, like, more typical. I don't expect my doctor to have it memorized. Like, yes, I do hope that they know that dogs are vector, carry rabies. But, like, I don't expect beyond, like, that, like a common household pet.
Yeah. You know who would? A vet.
A vet. I don't really expect that. So, like, the only decision that I would have made that was different would have been that I wouldn't have Googled it in front of the mom.
I mean,
I would have made some kind of fucking excuse, and you leave the room, and then you do it. And then you come back.
Honestly, you know what the other strat is? Have your med student / scribe do it for you.
That too.
Yeah, I was the one searching shit up all the time for the doctor. Like, the doctor that I worked with, you know the one. Basically, like, there were a lot of things that, like, sometimes he just didn't know because, like, they're newer than he was. Like, fucking, oh my god, I get to talk about this today. Something called pre-exposure prophylaxis. So, like, HIV medications, antiretrovirals. He didn't know about the newer ones. He only knew about, like, the usual antiretrovirals, but he didn't know about, like, the new advances.
Right.
And fine. Like, I knew what they were because the patient was like, hey, I was thinking of getting started on PrEP. The doctor was like, wait, what's PrEP? And I was like, oh, PrEP. And he looked at me and is like, you know what that is? I'm like, yeah, I do know what that is. A lot of my, I volunteer a lot, and some of the people that are at, like, the shelters and stuff, they are on it for free.
Yeah, and I don't think there's anything wrong.
And so it was a good learning moment.
Know something as long as they're open to learning about it.
Yeah, and he was very open to learning, and, like, we ended up looking up stuff about PrEP right online. Because he didn't know, but I knew. But he needs to know, like, the dosing and, like, the regimens and all that. So I had to go pull up a few papers. And we did that in class. Oh, Jepping, this is a bit different. This isn't, like, this isn't pre-exposure, post-exposure prophylaxis for rabies. This is pre-exposure prophylaxis for HIV. Because this person is a man. This patient was a man who had sex with men. He was gay.
Do they recommend PrEP for lesbians? Or just gay men?
I actually don't know. You know what? Let's look it up.
Because I just realized that when I think of PrEP, I think of it as like something that you exclusively provide to AMAB patients who are having sex, like with AMAB.
Oh, they can. They can utilize it.
Non-monogamous relationship.
They can utilize it, but it's not.
Okay.
It's not like.
Would you also give PrEP to a heterosexual monogamous couple if one of them was HIV positive?
Yes.
Okay.
Yes, you would. Well, actually, the patient, if the other person in the couple, the other person in the couple should be on like antiretrovirals, like and either nucleoside reverse transcriptase inhibitors or non-nucleoside reverse transcriptase inhibitors, so that they have an undetectable level of HIV. But barring that, yeah, the other person should have PrEP.
Okay.
Oh my god, I'm using what I learned today in class. I'm so excited. Yeah, because like that was our lecture today. We learned about STIs. We learned about female anatomy, like female pathology. So like the what's it called? Like we learned about Bartholin's cysts. We learned about like intraepithelial neoplasia and carcinomas. So like squamous cell carcinoma of females. We also learned about HPV. We like the carcinomas and shit with HPV. The strains of HPV that can cause cancer. That would be HPV 16 and 18. Which, by the way, if you guys haven't had your HPV vaccines, I would get started on that.
Oh yeah, I got that when it came out.
Yeah, I didn't.
Oh, that's what I had to always like, it's on my list, but then it's so, like, I hate to say so low on the priority that I never bring it up. I have to ask him, or I mean, I can just Google this.
You can just ask me.
I got the original shot, like the original ones that were like fresh on the market. I think my parents had to pay out of pocket. Like insurance wasn't even like covering them yet. Kind of new shit.
When did you have it done?
Yeah. Probably like sometime between 2012.
Oh, also jumping. Have a good night.
And, let's say sometime between 2010 and 2013. Would be my guess. And I know now the vaccine has changed.
Yes, it has.
It's better. It's
yes.
better. It's more protective of all
the new
strain. And I can't remember if they recommend that people in my situation who had the original series go back and then get it again. I actually.
Oh, hi Infame. Welcome in. Thank you for the first time chat. And I would have to double check. But
yeah, I have to look. That's why I'm always like, it doesn't really.
So according to the CDC, they're talking about the Gardasil 9, which is the newer one, because this is the one that protects against 9 HPV types, which is 6, 11, 16, 18, 31, 33, 45, 52, and 58. In the past, you probably had the Gardasil 4. That was the bivalent, and that was against 16 and 18. I would recommend you get the new one, honestly.
Okay, I'll talk to my dude.
Yeah, get the new one. I need to get the new one.
I also thought they said that there was an
Yes, we are talking about vaccines. Well,
I thought they said that there was an age range, and I thought you and I were too old.
No. Okay, so we're too old for the two doses. So basically, the recommendations according to the CDC. This is all from the CDC, and it's still pretty valid. Thankfully, they haven't changed it too much. And also, Kimmy, thank you so much for this stream. Oh my god, amazing. So for children age 11 to 12, they should have 2 doses of vaccines given 6 to 12 months apart, and the HPV can be started at 9. Also, in fact, I want to get to that in a second. For child 9 to 14 who already have received 2 doses, they'll need a 3rd dose. For people that are 16 to or 15 to 26 who started the series later, they need 3 doses. We kind of fall into that category.
Okay.
Though, okay, so technically people older than 26, vaccine is not recommended for everyone older than age 26. But honestly, it wouldn't fucking hurt. Like, for example, HPV, the HPV or Gardasil 9, or HPV 9 or the Gardasil, the new Gardasil. But so, according to the CDC, I'm going to quote unquote here, some adults aged 27 to 45 who are not already vaccinated may decide to get the HPV vaccine after speaking with a doctor about the risk for new HPV infections and the possible benefit of vaccination for them. People in this age range provide HPV vaccination in this age range provides less benefit because more people in this stage have already been exposed to HPV. But also, like, it wouldn't hurt. It wouldn't hurt. Like, it's not gonna make anything worse. You're not gonna die. So, like, yeah. Yeah. And so, PSA, get your vaccines. All of them. Unless you're, like, contraindicated. So, in that case, talk to your doctor before you can. If you're immunocompromised, do not get the live attenuated vaccines. Get the dead ones or, like, the toxoid ones. There's a list of the live attenuated vaccines. I can, like, write that up later. But the CDC still has, like, all the lists of vaccines. Sometimes I'm paranoid, so I just, like, do the archived versions of the CDC, like, from a few years ago. Because, like, I don't trust shit nowadays. God, it feels weird saying that I don't trust the current DOH. But I'm not even... It's not even bad for me to say that because, like, it's true. I do not trust them nowadays. I don't trust RFK. I don't trust the current Surgeon General because she's not even a fucking doctor.
Well, was she sworn in?
I think she's doing hearings first. I hope she doesn't get sworn in. I really hope not. Also, Jesus Christ, y'all are really, like, hitting me, huh? Yeah. But okay, Infe, back to your question. What if a zombie apocalypse is going to happen in the future? Honestly, I wouldn't fucking know scientifically.
Oh, well, wait, hold on. There are these people on Twitter fear-mongering that apparently they were like, this mold is spreading and it eats humans from the inside. If you see that shit, it's not actual real. I mean, it is real, but, like, it's not. They're fear-mongering. It doesn't eat you from the inside. It's not like this, like, you know, that video game. It infects you and it causes, like, necrosis and shit. But if you're not immunocompromised and you are a regularly healthy person who washes your hands, you're fine. Yeah.
You guys should be more scared of, like, COVID than that weird mold or fungus.
I'm more fucking scared of...
People are on the human cordyceps thing again. Yes.
Or fucking C. diff. Like, genuinely. When I see nurses in the nursing subreddit who are like, oh, it's your turn to get C. diff, I'm like, are you fucking kidding me?
I don't want to get C. diff ever.
I don't want to get the C. diff. What do you mean it's my turn to get the...
And also, Shade, I completely agree. I don't blindly trust anyone in the government anymore. And always talk to your doctors, educate yourself as best as you can. And honestly, if you want to talk about vaccinations, you can look at the, I would recommend looking up the American, so, like, a lot of physician organizations, so, like, ACOG, the American American something of, like, obstetrician and gynecologists, they have a lot of good information and recommendations for people. And, like, so...
Don't get your information on Twitter.
Don't get your information on Twitter unless it's from me. I'm joking. Please. I do not want to be responsible for anything that you guys do. Unless, like, you're just doing the good things of drinking enough water every day, eating food, eating veggies, etc. That's fine. Common sense stuff. How many COVID vaccines are you supposed to have? Honestly, I have not been keeping up with that information. I haven't been keeping up with all of that fully. I wish I were. I haven't had time because like new stuff has been changing. A lot of stuff has been changing with COVID, but like,
are they even still making vaccines?
yeah, they still are. Yeah. I got updated most recently, like as of 2024, with Novavax. I like that one more because it's protein and not RNA. Not because there's any fear mongering with RNA, mind you. It's because the RNA one, like, I reacted really badly to it. So, yeah.
I
common sense shit.
hated when I got my first like COVID shot. My entire arm.
Yeah. I was sick
red
for like a
and I was
day.
like- yeah. My entire arm, like if someone so much as touched it, I like started crying.
I fair, valid. But yeah, like for me, just I don't know, just you just have to stay informed, look up things like from verified sources, etc., etc. Now we're gonna go on to, well, I was supposed to talk about like firstly, you want to talk about STIs? Do you want to talk about STDs?
Sure.
Yay! Did you know that the groups at risk for STIs are adolescents? This is according to the handout that we got, so it's a little bit out. It's a bit, I don't like it as much. But like, so groups at risk are adolescents, people that are like having risky sexual behavior, so unprotected sex.
The queers.
Hello, me. I mean, yeah, they did mention men who have sex with men, and those who are using illegal parenteral drugs, so like heroin and shit. Which, yeah, obviously,
Illegal
don't
what
share
drugs?
needles. Parenteral, so like the IV drugs. Parenteral
when
administration.
When people get that Dilaudid, when they get that good shit, the Fent.
What the fuck? Manny, holy shit. But yeah, here are some general features of STIs.
Am I wrong?
You're not even wrong, that's the problem. STIs spread from the urethra, the vagina, the cervix, the rectum, or the oropharynx, and most organisms depend on direct person. No! Ketamine is not safe.
No, don't do street ketamine.
Don't
No.
do street ketamine. Like, if you needed a ketamine therapy, like, dude, go to fucking Ann Arbor. It's approved for, like, depression. I would not recommend this.
It is, but even then, usually insurance won't cover it.
They won't
It's
cover it.
expensive as
It's extremely
fuck.
expensive.
And even then, like, there are many clinicians who, like, ketamine infusions are one of the, I say treatment in kind of quotes because, like, it doesn't really work for a lot of people.
Exactly.
Like, it's one of the treatments that has, like, kind of approved for, like, CRPS. And there's a reason that I've never tried ketamine treatments. And it's because my foot doctor, my primary care doctor, and my pain doctor were all like, you got too many mental illnesses. They're not gonna be.
Girl, I would not allow you to do that as well. So add on your VTuber friend who is going to be a doctor to that list of people that do not
like,
recommend it.
There are a lot of contraindications for fucking ketamine, even in a quote unquote perfect clinical environment. Let alone fucking street horse ketamine.
Horse ketamine is crazy. No, do not take the Uma Musume ketamine, guys. Please. Leave that for the Uma Musumes. They need it more than you. Let Rice Shower have her horse ketamine. But okay, so again, most organisms depend on person-to-person spread, and transmission often occurs from asymptomatic patients because they are not aware that they have the disease, and they just go fuck around. Like, there's not even any problem with fucking around. Like, good for you. Have fun. Just be safe about it. But if you don't know that you have the infection, horses talking. Oh, bye. No. Sucho. No. Girl. Maddie, help. Sucho was recommending horse electrolytes and horse ketamine. And I'm like, no, leave that for the Umamusumes.
Why are we wanting to recommend horse? What are we?
They want horse ketamine and they want horse electrolytes. And I am saying, no, leave it for the Umamusumes. Gold Chip needs her ketamine. Let Gold Chip have her special K. Let Gold Chip have her special K, guys.
That's exhausting. So horses are a lot bigger than people.
That too.
First off.
Yeah.
And they process things differently than people do.
Yes.
So that, but also, there are bacteria, not so much when we're talking about these medications, but when people talk about the horse licks, the horsey treats that people are eating,
yes, no, I heard about that.
The danger in and of itself is not necessarily like the ingredients in the salt lick.
Right.
Because a lot of these, like, from what I've seen, they don't always seem to be like true, like, quote unquote salt licks. They're like, because the people are listing out the ingredients and it's like fiber, apple, and it's like, it's not, they don't seem to be primarily salt. From what I've seen, I could be wrong though, because I don't do a lot of research on fucking horse treats. But like, these people, and from also, these people don't say that they taste like something that has a high sodium content. Like, these people are actually like legitimately enjoying these things. So
people like them?
Oh yeah, people love it. People absolutely fucking love them.
Yes, it's lead flavor, but I do not recommend it. No, not allowed.
So, a lot of these people, they try them, and it's not the ingredients in and of itself in the horse slick that are innately the problem. The problem is that they're made in these factories that do not have the same regulation and safety.
Yes.
That is required for human consumption because there are bacteria and contaminants and all this other shit.
Hey, thank you for following. Welcome in.
That could
Hello, May.
hurt humans, but have no impact on Mr. Pony.
Yes.
Okay?
Umamusumes are built different. And they have weird stomachs. Hi, I'm doing pretty well. How you doing? We're talking about random shit right now.
Lev is not going to agree.
Lev will not agree with you because I will tell her about this.
Lev, like, we like to clown that, like, oh, Lev is a psychiatrist and now medicine, what? But, like, they are still a fucking medical doctor.
Yes.
And they, like, have a brain that she uses.
And also, May, nope, we are gonna keep yapping. We keep yapping.
ADHD fucking D keeps us going.
I know. Oh, okay. But okay, so let's go talk about the more general features of STIs. So, microbes that cause STIs can also have vertical transmission. So basically, it can go from pregnant mother to fetus, which is bad. And that's how we get shit like gonococcal conjunctivitis and like babies. Horse food is not tasty. Don't fucking eat the horse food. Stop it. Guys, stop it. The fuck? But okay, so let's talk about herpes virus first. Herpes virus 1, or herpes labialis. This is typically transmitted. Huh? What do you mean she agreed? What?
I don't believe you.
I don't believe you.
Screenshots or it didn't happen?
Proof. Give me fucking proof. She hasn't even responded yet. She literally hasn't even responded yet. I am looking at the chat. I am looking at the Discord. No, she did not even respond.
In her Discord?
Yes, it's in her Discord. Yes, it's in her Discord at 12:08 a.m. my time. She hasn't even responded. I'm looking at it. There's no response.
I can literally, we are all in this motherfucking server.
We are all here. I don't. No. Sorry, study orientation. I am so sorry.
Hold on. Oh, her status. She's offline.
Okay, wait. I need to concentrate. Oh my god. You can handle the chaos, Maddie. Is that okay?
No, I have to do my fucking project.
So I have to do my
They can literally, like, we don't do horse drugs.
No horse drugs. Something
No
PSA.
horse drugs, no
Someone
horse-
clip this. No horse drugs allowed. No horse meds. No horse food. We are not horses. We are not horses. Thank you, Shade. Thank you, Shade. You're the best. But okay. Herpes labialis. This is typically transmitted from person to person via infected oral secretions during close contact. And this usually happens when someone with no prior infection with HSV comes into contact with herpetic lesions, mucosal secretions, or skin that contains HSV. And this is a major cause of corneal blindness. Yes. Corneal blindness and fatal sporadic encephalitis. Not this part, but like the no horse drugs at all. Not allowed. HSV2. This is herpes genitalis, and this increases the risk of HIV transmission and HIV acquisition. Sucho, I do not agree. Sucho, no, stop it. And depending on the sexual practices, HSV may also be detected in the genital region, and HSV2 may cause oral infections. I'm not going to describe why. You guys can put 2 and 2 together. The clinical course of herpes simplex viruses in HSV infection. So, first step, it enters the skin and the mucous membranes. What? Herpes and IUD collab? What? I mean, no?
Wait, what?
So IUDs aren't going to increase your risk for like herpes.
How would it? Okay, and I'm genuinely trying to understand this. Like,
STIs, yes.
Where would this idea come from?
Oh, it was a typo. Herpes and STI collab. Yes. That's what this is.
Oh, thank God. I was
very curious. Though, actually, there is a thing. If you already have BV and you have an IUD, there's more risk of it like coming back. Fun fact.
Right, but that I can see that because it's all fucking connected.
Yeah, exactly. That makes sense. Though I actually don't know if you have to like remove the IUD and put a new one in. Do we? We don't have an OB. We don't have an OB VTuber to ask. Fuck. We don't have a gynecologist VTuber to ask this question to. We have JF, but I don't want to ask him that.
Oh, I have no shame. I would, because he does.
Oh wait, does he actually does gyne stuff? No. Oh, I'll ask him.
Well, I know at least he's trained to, and he would feel comfortable doing it. How often he actually does it as a 32-year-old?
Wait, he's only 32?
Well, that's my approximate guess based off of when
he's like 3 years older than me. He's gonna be 3 years older.
Our undergrad.
Also, yes, copper IUD for women. Yes.
Well,
so
actually, wait, hold on.
Also, fun fact: copper IUDs can be used to as a form of emergency contraception if placed basically very soon after sex.
My bad. He's 30. I think he's 33, 34.
Oh wow. So he's only.
I think he graduated 4 years before me.
Oh wow. Damn.
From undergrad.
Okay. Fair. But okay, back to what I was saying. Clinical course. It enters the skin and mucous membranes. The lesions will appear after 3 to 7 days and is associated with systemic symptoms. This will start as red papules that become vesicles, and then they become ulcers. And these are going to be visible on the vulvar skin and the mucosa, and those in the cervix will present with purulent discharge, so pus-filled discharge. I'm not going to use the other word for it, and pelvic pain. And near the urethra, there's going to be painful urination and urinary retention, because obviously if you're in pain when you piss, you're going to not piss as much or not be able to piss everything fully. So go figure. The mucosal and skin lesions will heal spontaneously in 1 to 3 weeks. Hey, Zanza, welcome in. And Twink. Oh, I mean, copper IUD is whatever. Honestly, like, this is new. This is like relatively new, but like I believe that nowadays they should at least like inform people of the paracervical like block, or like paracervical like lidocaine for IUD placement, because it's very helpful.
Well, I heard some doctors say that there's no evidence that it actually assists with the pain.
Anecdotally, yes, it does.
Well, right, I know. Like the evidence that like the people say that like the evidence, and I'm saying this as I haven't reviewed it, that like you essentially like you're administering the block not because it actually physically will actually help, but because it's essentially a placebo. Like the patient feels better. I mean, I
can literally
like
tell you how it felt when it happened. I felt nothing.
Well, right. Yeah. That's kind of. I'm kind of like, how would it not do nothing though? And I feel like it at least has to do something.
No. Like what I mean is, I felt nothing when they actually installed the IUD.
And did you have a block or no?
Yes.
Yeah.
I did.
See, like that to me, I'm like.
It did its effect. It did its effect. It anesthetized the area.
And I had an endometrial biopsy. And that was one of like the most like horrific. No. Horrible.
Oh my god, Yune, hi!
An IUD is, well, I mean, it's not really medication, it's a device.
So it's a device, but like it still has medication in it.
Hey, Yune.
Hey, Yune.
Do you know, if someone gets BV and they have an IUD, do they have to get the IUD out?
And get a new one?
Mm-hmm.
But okay, back to what I was saying. So clinical course, basically mucosal and skin lesions will heal. Oh, you don't know. Okay, that's fine. Will heal spontaneously in 1 to 3 weeks, and during acute infection, the virus will migrate to the regional lumbosacral nerve ganglia and become latent, only to develop into a recurrent infection depending on triggers. So stress, low immunity, trauma, hormonal changes, etc. Twinkie, that means that's not normal and you should go to a doctor. There should not be. The normal amount of blood in your urine is 0. The normal amount of blood in your urine is 0. That needs to be said. That is a PSA. Exclamation point clip. I hope it works. Did it work? Did it work? Where's my clip? Wait. Saribot? Hello? Hello? Damn. Saribot doesn't work. Fuck. What was I gonna? Yeah. But yeah, no, for real. Like, look, Twinkie, thank you. Like, Twinkie, if it isn't a joke, that isn't a joke, I'm telling Mr. Manager. You know this. Okay, the pathology.
Also, just like, maybe this is just me. And like, I'm not trying to shame anyone, but like, please don't make jokes like that in general. It's not funny or cute.
It's concerning.
And it's concerning, and then like, even in like non-medical streams, don't do it. Like, just no. Like,
because like for me, dude, I get worried when y'all tell me like, hey, I've been peeing blood for the past year, and I'm like, huh? Because text does not convey tone very well. So I take everybody at face value.
Well, also part of that is it's called autism.
I mean, yes. Well, I'm trying to not completely mention that. Yeah, like I worry. I worry about y'all. Please don't die. Please? Please? Do I have to beg for that?
Apparently.
I guess. Yeah, like there's a way to make it sound like jokes. Okay, Yude. No suffering. Exactly, no suffering allowed. Guys, chill the fuck out. My God. And let's talk about herpes. Okay, thank you. Oh, okay. Well, that's understandable. Trauma is gonna do that. Yeah. Trauma, hematuria. Hematuria can happen after trauma. Oh my God, welcome in. How are you doing, buddy? But okay, back to what I was saying about, yeah, we've been talking about herpes the whole time. HSV, herpes simplex virus. I'm doing pretty well. Like, yeah, exactly. Vanny's joke is funny. And also, it sounds like you're gonna be the Rat Man. It sounds like you're gonna become the Rat Man. What? You had to like figure out a superpower and a new outfit because you're the Rat Man now. Did you get bitten by? Exactly. See, like this. But back to this. So, herpes simplex virus, the pathology. So, yes, like me. I'm a bald rat in a cage, guys. Okay, so we're gonna talk about herpes. Basically, in like the lesions, when you like when you get a smear of these, there's going to be like weird cells with weird inclusions. I can put a picture up here. And yeah, you will also go bald. You're gonna turn to a bald rat.
Rip.
Seventh, yeah, I wish I knew. People are turning into rat people like it's Marvel. Yes, exactly. But yeah, we're gonna get a weird cell like this. I'm gonna show the picture right now. Image. This is the picture. The Cowdrey type A cells. These are hepatocytes with a large intranuclear inclusion body, and this is surrounded by a clear halo. I can kind of see it on here in this picture. It's like it's very like apparent. I'm gonna put it underneath the VTube. Like that. Okay, that makes sense to me now. Genital herpes. So these are genital mucous these herpes like lesions are going to be on the mucous membranes and external genitalia, and they may be transmitted to neonates in vaginal deliveries. Neonatal HSV2 infections are going to lead to necrotic foci in the lungs, liver, and the adrenal glands, and also splenomegaly. So it's bad. This is not good. HSV1 is that's what you think of as cold sores, basically. This is gonna present as what you know commonly as cold sores. And yeah, I'm a rat now.
Which is why you don't kiss. Well, I see people who are like, oh no, only the parents can kiss the baby. No, parents can still transmit.
Yes, you can still transmit
this to your children. Mm-hmm. You shouldn't.
Don't kiss your kids on the mouth.
Well, I've seen people who have transmitted it, like they kissed their kid like literally on the head, and now and it's like
really
that is enough. Yeah.
Huh.
I assume it's probably like a combination of factors of like
I think it's a combination of factors because I'm
the kid might have had a boo-boo.
Yeah.
You know, you accidentally kissed it, it got in. But like I would just go as far as I think not kissing on the lips, the nose, don't, you know, near the eyes.
Yeah, basically just
parents,
don't. Yeah.
Parents and others. It's everyone. Just don't do it, or at least know the risk.
Also, yay! Hell yeah, Zanza. But yeah, so recurrent lesions in HSV. Okay, so I'm gonna continue. Right? I agree with you, Vanny. Who the fuck would do that?
Who the fuck would do what?
Kiss their kids on the mouth.
Oh, I know adults who still kiss mommy and daddy on the mouth.
What?
You heard me.
What?
I might be blood related to some of them.
It's your twin, isn't it?
No.
Oh,
We
okay.
never kissed our parents on the mouth.
Okay. I wasn't, because like, look, everything you've told me about your twin, I do not like her.
No, I have some white cousins.
I mean,
just really white.
Oh. I mean, so okay, I do kiss my parents, but like on the cheek. Maybe I hug them.
Your parents a kiss on the cheek, and
yeah, that's normal.
Giving your parent a peck on the mouth.
No mouth to mouth contact, guys.
Apparently, we don't like our parents.
I don't want to swap spit with my parents.
Boo.
If that's like the measurement of like, if it's the measurement of like how much I love my parents, then I guess I fucking hate them.
I don't want to swap spit with my parents either. But
yeah, which means obviously we hate our family. Obviously.
Yeah, apparently.
Exactly, obviously. Freezer, I don't know what the fuck you joined in on. I am so sorry. I'm so sorry. We're just yapping. It's giving smiling friends. I'm very confused. I'm just talking about herpes. But yeah, so primary. We're gonna talk about primary herpes simplex 1 infection first. So this is going to present as gingivostomatitis in children and as severe pharyngitis in adults, and will it be associated with systemic systemic symptoms, so fever, body weakness, lymphadenopathy. But recurrent lesions are going to present as cold sores or fever blisters, which start as localized, basically vesicles. So what I mean by vesicles is like they're gonna start off as like little localized blisters. But okay, freezer milk. So basically, you join in. You basically join in at like one of the funniest parts. Yeah, exactly. I was also raised. I mean, I was raised by my parents. Or Filipino. I have never been asked to kiss my parents or my family on the lips. That's fucking weird. And if swapping spit is how we base our love for our parents, then obviously we hate them. I'm straw manning here. I'm making up a guy. I made a straw man, and I'm straw manning to make a point. My point is very weak. I made up a guy that defines love as swapping spit with parents. Oh, it relates to herpes because oral herpes, so HSV1, can be spread through mouth-to-mouth direct contact. But this also relates to herpes because like Maddie was like, this is why we don't like kiss other people's kids. Yeah. On the mouth. Yes. Well, Yeah, basically. But I am glad that you're here. I don't know why that segued into that, but okay. So, this is gonna be, so the recurrent lesions, the cold sores, are gonna be typically seen at the vermilion border of the lips and on adjacent areas. So like right around the lips, basically just the lip area. And it's usually, it can happen on both sides of the mouth, and it's not dermatome dependent. I mean, no. You can smooch your kids on the forehead. That's allowed. That's fine. Not on the head.
Yeah, smooch your kids on the head, their baby bald heads.
Yeah.
I mean, be careful of the soft spot, but you know.
I mean.
Yeah, you can.
Yeah, the anterior fontanelle is a soft spot, but yeah.
Yeah. In the chubby cheeks, like that's mandatory.
That's allowed. Just not on their fucking mouth or their eyes.
Well, yeah, yeah.
Oh my god! Hi, welcome in. How are you doing?
Yeah, I would
Hello,
even like
Toasty.
avoid like the temple. You know, like the area like right next to the eye, just near it, just because they touch their face.
I'm just giving examples of mucosal areas, Freezer. I'm just giving examples of mucosal areas where people could possibly kiss. I'm making contingencies because I realize I have to say, hey, if I don't mention it, apparently people might do it, so I must mention everything. I feel like I have to mention everything now. But okay, now we're gonna go into corneal lesions from HSV1. So, basically, there's gonna be immunologic reaction to the herpes simplex virus. And that's gonna lead to keratitis. You're gonna have like super weird thickening of the lesions. What? One minute. Personal opinion, but I prefer getting licked on the eye. Do you mean kicked? Is that a typo? I really hope that's a typo. Do you mean kicked? Please tell me you mean kicked. Kicked, licked on the eye, then kissed on the eye. Okay. Question. That's basically the same thing. Hello. Welcome back. You're here at a weird time. I am very uncomfortable with the energy we have created in the studio today. What do you mean licking eyes? What the fuck do you mean? What? Wait, welcome back. Are you sure you want to be here for this? Okay, there's a shit ton of like different kind of herpes like manifestations. Fun fact, did you know that there is something called herpes gladiatorum?
Do I want to?
Yes, you do.
Okay.
Herpes gladiatorum is acquired by skin-to-skin contact among wrestlers.
Oh, yeah.
Yeah.
I didn't know that.
Fun fact.
You could again get it on the face? Yeah.
Mm-hmm.
Bad.
Well, let's see what Freezer Milk says. I mean, if I was in this hypothetical situation where am faced with the choice to get licked on the eye or kissed on the eye, you will pick licked on the eye. But they're the same. It's gonna lead to the same effect. There's still gonna be saliva in your eye. I don't think you want it.
I'm not letting anyone lick my fucking eyeball.
Yeah. And also, May, why are you asking if my stream is gonna end soon? I'm not. This is a 2-hour long stream, buddy. 2 to 3 hours. Basically, it's gonna end like around, I don't fucking know, like 1 p.m. What time is it right now in EST? Or CST?
10:30.
10:30, so 10. Yeah, so like 3 hours. It's gonna be on for a while. I mean, yeah. Okay, see, cinnamon one, that makes more sense. EC is 11:34. Okay, yeah, basically, like, we're going on until, like, if you want to think EST time, like, 11, 12, 1, 2. So, like, to... No, you're not really missing any important topics. We're just yapping. And also, Vanny, yeah, I have no... Yes, that is true. This stream sometimes outlives every other Dreamer stream because I am insane and I just keep talking. Because I like talking. But yeah, so there are also just... We already went over herpes gladiatorum. We went over herpes gladiatorum, and now we're going to go on to disseminated skin and viral herpes infections. Gladiator, okay. Disseminated skin and visceral herpes infections. So this is where we have things like eczema herpeticum, we have herpes esophagitis, we have herpes bronchopneumonia, and we have herpes hepatitis. And we also have Kaposi's like varicella form eruptions. It's all weird. That's the real answer. But I mean, also Vanny and Freezer. The interesting part is that like when my stream outlives everybody else's, and if I am able to maintain the number, then I can just throw those numbers to another dreamer. It's like a big game of hot potato. The last one, Kaposi's varicella form eruption. These are all things that are going to be happening in immunocompromised patients. Wait, what the fuck? It didn't put the K. Kaposi's. It ends and starts. Because like technically, I actually don't know. Like, because like when I looked at the schedule, sorry, ADHD moment, guys. When I looked at the like streamer schedule, usually I'm the one that starts the thingy off, basically. The etiology on this one, so I can yap on that in 2 seconds. Kaposi varicella form eruption. So the etiology for this is also known as eczema herpeticum. This is a disseminated cutaneous infection. So this is going to be an infection on your skin caused by herpes. Wait, really? Zanza, I have no clue. That I have no clue.
What?
Oh, Zonzo was asking if there's any parasite or virus that has been researched for their potential benefits. No.
Well, I'm sure.
I mean, probably.
Like, yes, I can't think of a complete example right now, but in my microbiome class, I mean, they are doing research on using, like, different viruses.
Oh, I mean, bacteriophages.
Like, yeah, like as vectors so that you can transport some other kind of information into a person as a form of gene therapy.
Yeah, but
like,
we're talking about bacteriophages. Yeah. I know those. Those are cool. But KVE, or Kaposi varicella form eruption, which is also called eczema herpeticum, is a cutaneous infection, a skin infection caused by herpes simplex virus type 1 and more by type 1 than type 2. Etiology. So it's really just it's mainly caused by HSV1, though it can also be caused by 2, Coxsackie virus, A16, vaccinia virus, varicella zoster virus, and variola virus, also known as smallpox. All of these things are, I mean, yeah, actually, shit, you know what? Yeah, I completely forgot about leeches. I forgot about leeches. Leeches are the goat. Leeches are the fucking goat. Leeches are awesome. Leeches are prog. Yeah, though no. Leeches are still being used in modern wound care. Yeah, I've seen them being used. I've seen leeches. I have not held a leech, but I want to. But like, Vanny, you're just putting more words on my name, and I'm very confused. Yes, exactly, Shade, you're correct. There's a whole industry that breeds medical leeches and maggots for that purpose. We love wound care in this chat. Wound care is awesome. But yeah, pathophysiology, I think that's what you're asking for, Sevens. The pathophysiology of KVE, this was initially assumed to be secondary. The maggots are there, yeah, basically for debriding. It eats the necrotic tissue. It also keeps the blood flowing. Well, no, that's leeches. Leeches keep the blood flowing. But like maggots are for debriding. Yes. Yes.
Unless
Unless
the patient got the maggots themselves.
Maddie, why did you have to remind me of that?
Because I'm never going to forget the lady that I heard about who was coughing up the maggots.
What? Wait, run that by me again. What?
Never going to forget the lady
Okay.
who I read about in the nursing subreddit. People were talking about like, what's something that you've seen that you'll never forget?
Uh-huh.
The lady coughed up maggots.
What?
I don't know. No one ever was able to explain to me how that was like physically possible.
Nobody asked for, did people ask for like a follow-up? Did people not circle back?
I mean, people were like, what the fuck? But no one was like, can you please explain the physiology behind how she could still be alive and have maggots coming out her mouth? I think Annika and Rico, their best guess was like, she probably had like some wounds in her mouth. And so they weren't, because the nurse in the story was pretty adamant that these maggots were somehow coming from her lungs. But I don't know how you could really know that. I am more inclined to believe Rico and Annika, who said that this usually is a sign of like nursing neglect, where
yeah, obviously.
a patient has been on like a vent and you haven't been doing proper dental care.
Oh no.
And so then the patient, like, you finally go and you know, they're still vented and then maggots. So they were more inclined to think it was something like that.
That makes more
this
sense.
lady, they didn't mention a vent. Like, she was fully present.
She was fully present?
Yeah, she's there coughing up the fucking.
Okay. Crazy. Now I never get to forget that. Thank you, Maddie. Thank you so much.
You're welcome.
It's 1 a.m. in 15 minutes. Yes, it is. You know the stream ends at like fucking 2, right? You're gonna be stuck here for a while. Sometimes it just doesn't end until I go to class. Well, freezer milk, you don't get to. You don't get to sleep with that knowledge. You don't get to sleep anymore.
I just really want someone else to. I want confirmation that, like, basically the only possibility is the vent. Because the idea that it could be something else, and that the other nurse, I want someone to confirm for me that other nurse is full of shit, is basically what I'm saying.
Now I just want to hear from the other nurse. I want to hear from the other staff.
What? If
it was real.
So I believe it was real. Because we get a lot of interesting shit in the nursing subreddit.
That's true. We do. We really do. You also get weird shit in the doctor subreddit with the balls.
Yeah.
The balls.
But like, I just kind of want to know. I want confirmation. I want confirmation that it was only,
Maybe, you know what? Maybe I don't even want to. I don't want to think about it. I don't want to think about it. I don't want to.
What?
I don't want to think about the possibility. Also, Stealthy, or Sevens. The person on stream is Maddie. 1 minute. I'm pretty sure do a canoe. Pretty sure I could. Yeah, this is Maddie. Yeah. Lev is green. Maddie is pink.
Oh no, I'm not Lev. I don't have any actual credentials or anything to validate. I'm just.
Oh my god, hi, Mr. Manager. How you doing? I mean, you're more likely to like shit out a tapeworm than to cough it up. That's just on gravity, though.
Yeah, I guess.
You're more likely to shit it out.
Or well, try to shit it out.
I mean, you can shit out parts of it. You can definitely shit out parts. Freezer, this is not a challenge. I do not want to find out. I don't want to find out if you can cough it up. You're not getting tapeworms. You guys are not allowed this. Hey, shit. Hi, Peachy. How are you doing? How are you? Where? MSO. Peachy. No. Guys, drink your water. No tapeworms. Have a good day, etc. Oh my god, how do I spell? And yeah, I mean, I did say hi, Mr. Manager. And no rat juice. No rat juice allowed. And can I go back now? Wait, fuck. There I am. What? Wait. Damn it. Wait. How's this? I got tossed around and I'm kind of confused at where I'm supposed to be. So I'm just kind of like trying to orient myself right now. Yeah. There we go. There's a position. There we go. Perfect. No rat puree. And also, hi Peachy. How you doing? We were supposed to be talking about herpes simplex viruses. Yo, I have no idea anymore. Nice! I'm glad you have a good day. I'm glad you have raspberry tea. That sounds delicious. And no, you cannot get... I don't think you can give tapeworms anything like that. Oh my god, you guys. But okay.
There was a guy in Grey's Anatomy who threw up tapeworms.
You didn't have to remind me of that.
Okay.
You really didn't have to remind me of that. Because now you're just going to make everything worse. But also, thank you for that reminder. Why did you do that? I mean, okay, actually, throwing up tapeworms makes more sense than, like, coughing up tapeworms to me. I know that's kind of semantics, but still. No. Okay, we're going to talk about HPV now. This is one, well, we were yapping about HPV earlier. So, like, there's low-risk HPV. So, with HPV, there's, like, different types of HPV. Different strains. And so, HPV, the low-risk ones are going to be 6 and 11. So with 6 and 11, these are where you get like the regular just genital warts, basically. You can have low risk cervical intraepithelial neoplasia or low grade squamous intraepithelial lesions. And yes, I agree, house is better than Grace. For high risk, this is going to be like type 16 and 18. And this is the one, these are like, all of these are the ones where you're going to be worried about getting. And this is why you need the HPV vaccine. But like the scarier ones are going to be 16 and 18. And most of the cancers are going to be happening with HPV 16 versus more 16 than 18. Now we're going to go on to chlamydia. Chlamydia. So, chlamydia trachomatis. This will exist in two forms. So, I'm going to pull up the sketchy picture for this. I think I still have a sketchy picture. Sketchy myth. Chlamydia. So, the fun fact about chlamydia. Chlamydia is a gram-indeterminate bacteria. And with chlamydia, chlamydia species are obligate intracellular bacteria, which means they have to be in a cell in order to replicate and to survive. They stain poorly because there's very little muramic acid in their cell walls. And also, tapeworms cannot survive in cooking oil. No. Tapeworms are fucking tapeworms. Don't do it. Chlamydia species have a unique developmental cycle with elementary bodies and reticulate bodies. The elementary bodies are the ones that can cause infection, while the reticulate bodies are the ones that replicate inside of the body. Chlamydia trachomatis causes this the one. No, don't do it that way. Chlamydia trachomatis can cause STIs, or sexually transmitted infections, with symptoms such as watery discharge. This can also lead to pelvic inflammatory disease, or be transmitted from mother to child during delivery, causing conjunctivitis or pneumonia. Chlamydia trachomatis can L1 and 3 can also cause eye infections, Reiter syndrome, something called lymphogranuloma venereum. A lot of weird things. Yes, and this is the world of chaos, and I have welcomed it. Basically the pathology. So like lymphogranuloma venereum, this is going to start as a small papule or a painless blister at the site of entry on the genital mucosa or on the nearby skin on the genitals. The organisms are then transported to the regional lymph nodes, where growth of the organisms and host response result in necrotizing lymphadenitis that erupts 2 to 6 weeks after the first lesion. So this is what chlamydia is bad. Gonorrhea is bad for many reasons, though, as well. But what was I saying? Right. You can also have buboes in this. Bubonic plague. You can also have buboes and chlamydia. These are going to be this is basically like pus-filled or suppurative and granulomatous inflammation with abscesses, and the buboes can be tender and may ulcerate. No, you cannot, Freezer. In females, inguinal nodes are not involved because the vagina drains towards the perirectal glands, and so instead, females that have lymphogranuloma venereum will have proctitis or renal fistulas.
Delicious.
It's also seen in those that engage in anal sex. Yay! Complications. Progressive ulceration to the penis, the urethra, the scrotum, or the vulva. There could also be, like I already mentioned, anal fistulas. You can have urethral strictures because of the damage and the inflammation. You can also have hemorrhagic proctitis. So you're going to be bleeding a lot. You're going to have like just a shit ton of stuff going on. Literally. You can also have rectal and retrovaginal fistulas. Nuki, I'm talking about STIs. I'm sorry. I cannot talk about alcohol tonight. I cannot talk about like alcoholism tonight. I'm sorry. And also, fun fact, with lymphogranuloma venereum, you can also have genital elephantiasis. Yay! Also, I want to look at what the fuck just happened in chat. Swinky said, this sounds like the legend of putting in a bunch of venomous insects into a pot until one emerges as the most venomous. Yes! Yeah, Blue! Genital elephantiasis. This is like one of the consequences of or complications of lymphogranuloma venereum from chlamydia, from one form of chlamydia. We all have fun here. We all have fun here. Oh. Chat, it looks like Benny doesn't know what genital elephantiasis is. So, let me explain. Let's go talk about what elephantiasis is. So, elephantiasis is basically like big swelling, lymphedema of a limb, or like it could be any region. It could be a limb, it could be the genitals, it could be the inguinal region. But ultimately, this is gonna have progressive enlargement, not in the good way, mind you. Progressive enlargement and distortion of the genitals, presenting significant physical, psychological, and social challenges and pain to the individual. Because imagine like so imagine like, so let's say this isn't a male. Let's say that this isn't a male. Let's say, imagine like you literally have a third leg. Like, not a proverbial third leg, like a literal. Like it got that big. Lymphedema can be categorized into primary and secondary lymphedema as well. Primary lymphedema is subsided based on the age of onset, but we're going to talk about secondary. Secondary lymphedema is going to be due to like shit that's going on. This can be resulting literal third leg. In a way, yeah, the forbidden boner. We don't want the forbidden boner. This is not a good boner. Because this is just inflammation and bad tissue. The tissue is fucked, literally. This is enlargement and hardening of limbs or body parts due to tissue swelling, basically. It's not good. It's not good. No, there is no fixing forbidden boner. I mean, you can have surgery, but like what causes forbidden boner? It can be a lot of things. Filarial worms can cause it, but that's going to be happening in the legs mostly. But the thing I'm talking about right now that causes forbidden boner is chlamydia. That is a consequence in like severely immunocompromised patients. So mind you, this isn't normal. Oh, what will the surgery do? No penor. Probably. This is probably a case where we're gonna have like radical penectomy. Probably. I'm making a conjecture.
Well, there's a VTuber, the one that I told you about, who she has. Well, actually, I don't know their gender. They have the same, the complex regional pain syndrome. And
yeah, you mentioned that.
They also have lymphedema.
Oh.
And they've been basically advised that they need to have their leg amputated.
Yeah, I remember that.
Which actually really sucks. They didn't mention this component, probably because it is super fucked up.
Right.
And they also didn't say like where their CRPS is. I assumed
probably in the leg as well.
That it was in the same leg.
Yeah.
So obviously their lymphedema has reached a point where amputation is the only option.
Oh no.
Amputation is contraindicated for people with CRPS.
Yeah.
like, there are some people who have been able to cut off their affected limb and find relief. There are other people who still continue, like, you essentially still have CRPS in the affected residual limb. So it's like, it's kind of one of those things of, like, you don't do it unless you have to. You shouldn't be cutting off your CRPS affected limb in the hope of finding CRPS relief. So, like, the possibility here, just purely speculating, obviously I don't know this person or their, medical situation at all. My concern as someone with CRPS would be that you wouldn't be able to tolerate a prosthetic.
I don't think you would.
No, I don't think you would either.
Yeah. And I looked into more of the surgeries for genital elephantiasis. There are 3 main components. Well, so according to Yamato et al. From a paper in 2021, we can do something called RRR, which is radical resection and reconstruction technique. This is what they described. This combines ablative, so like removal surgical techniques, with modern lymphatic reconstruction to achieve satisfactory form and lymphatic function in one surgery. There are 3 main components. This is going to be happening in mainly. So this is according to the paper. According to like the paper that I'm looking at right now, indications for RRR include genital lymphedema with gross fibrosis and verrucous skin changes. And as male genital elephantiasis is more common and challenging to manage than in females, the paper here focuses on RRR of male genital elephantiasis. So the 3-pronged approach, it's going to be radical elephantiasis tissue resection. So that's going to be removal of the tissue. Then we're going to have soft tissue reconstruction using skin flaps. And then we have lymphatic reconstruction. So they're going to try and build your penis back up. It's going to be hard, like, to do. Also, you also get your balls removed. You get an orchopexy to, like, prevent torsion of the testes. Oh, speaking of testicular torsion, did you know that bell clapper anomaly? Bell clapper anomaly is a thing where your testes are super mobile in your scrotum. And with that in mind, if they hit themselves a lot, like literally a bell clapper, like a literal bell clapper, can have testicular torsion. And did you know that it is an emergency situation, and the best time for your testicular torsion to like be repaired and your balls still be viable is within 6 hours, like before 6 hours. Yay! This is crazy. You're just yapping now about random bullshit. And yes, it would be a medical emergency. You are correct. And you know what, Shay? That is very funny. It's gonna be hard. My God, I hope not. Holy shit. It was a good joke. It was a good joke. I'm allowed to laugh. I'm allowed to laugh. Now we're gonna talk about gonorrhea. Or is gonorrhea the clap? Is that what it's called?
Thought so.
I think so. I think that's a slang term for it. Yeah. We're going to talk about the clap next. So, we have gonorrhea is a gram-negative diplococci, and it is one of the second most common STIs among like it's second to chlamydia. Like they're two and two, like they're basically it's like say if you have me and then you have Maddie, or like chlamydia and gonorrhea. Tag yourself. Which one do you want to be, Maddie?
Blood.
But yeah, so pathogenesis of gonorrhea. So basically the bacteria will attach to your the surface cells of your mucous membranes of your genital tract and like your urogenital tract and cause inflammation. There are different virulence factors. So we have the pili. These are hair-like extensions on the cell wall that that bind to the cell wall. They bind to CD46, which is a they bind to CD46, which is a protein expressed in all human nucleated cells. We have the OPA proteins, which are located on the outer membrane of the bacteria, which increases binding of organisms to epithelial cells and promote entry of the bacteria into cells. We have the anti-IgA protease, which is what attacks IgA. IgA is one of your antibodies. IgA is one of your antibodies. Immunoglobulin A. Antibody is a little bit of a misnomer. I should have just said immunoglobulin, but basically it's one of the things that fight infections. We also have LOS, which is lipo-oligosaccharide and peptidoglycan, which are released by the just the auto breaking down of cells, which stimulates production of TNF, which is something that can cause cell damage. I am going to look at this. Wait, let me look at this. I love this. Yes, no, I've seen this. No, I had to learn this. I had to learn this in class today. I love this chart. That's my favorite chart. Actually, you know what? I'm going to print it out and put it on my wall. Thank you for the reminder to print this chart out and put it on my wall. If you hear the printer going, you know why. No, that's literally one of my favorite charts. It's so good. Back to what I was saying though about STIs. So, there are different violence factors basically. Some are going to turn off your immune system so that it can continue to hide from your immune system. Some will attach to your cells, and some will cause more damage. That's the real answer there. The incubation period is like 3 to 5 days, and the pathology, you're going to have a lot of inflammation. We're going to have pus containing neutrophils with like eaten bacteria and submucosal abscesses. In males, this is going to lead to urethritis, which then leads to prostatitis. So like your prostate is going to be infected. Then we have the epididymis or epididymitis. Your epididymis is going to be infected, which is the tubes that connect your balls to your vas deferens, which is like basically it's the goo tube. Mr. Manager, it's already on. I already printed it out. It's gonna be on my wall, like later. I'm gonna take a picture of it and send it to you. Basically, the epididymis is your goo tube. It takes the sperm. It puts the sperm into the vas deferens, and the goo tube is gonna be infected. And then we have orchitis, which is your balls. Your balls are infected too. Like, yeah. In females, you're gonna be asymptomatic in like 50% of cases, but in cases where there are symptoms, you're gonna have endocervicitis, you're gonna have urethritis and abscesses in the Bartholin glands, and there's also gonna be pelvic inflammatory disease. Complications. Honestly, Yune, that would be amazing. You should. Complications. We're gonna have urethral strictures because like if there's a shit ton of inflammation and damage, you can't piss well. There's going to be like blockings in your piss. There's going to be infertility, obviously, and there's going to be there's going to be like spread to your peritoneal regions, and there's also going to be like and then there's also going to be chronic endometritis. In kids, though, like
endometritis.
endometritis.
Like infection
Uh-huh.
of the
Uh-huh.
fuck no, oh my god.
Uh-huh. Infection of your endometrial lining. So, be safe. Condoms are useful. Get tested, etc., etc. And in neonates, this is what we're going to have gonococcal ophthalmia neonatorum. So basically, gonorrheal infection in the eyes of neonate. It's gonna come out and it's gonna like conjunctivitis and like eye stuff, eye infections. Though there can also be disseminated infection. So like if there's bacteria in the blood and it keeps going forward, and when that happens, you could have endocarditis, you could have meningitis, or you could even have arthritis dermatitis syndrome. All of this is not good. And in adults, you can have conjunctivitis as well. Transmission can occur via direct sexual contact with infectious secretions. I'm going to leave that to you to have the image of, because I'm not going to describe it any further. Yay! Now we're going to go on to syphilis. I mean, yeah, you should pee after sex. That's very good for like reducing the risk of like UTIs. But also, you should get tested. You should get tested if you're like having a lot of sex. That's just a common sense thing. If you're unsure about like your STI status, you might as well just get tested. But also, like, if you haven't had sex, you don't really have to worry about the possibility of an STI. But, like, if you have, and you do it a lot, and maybe, like, you're not very safe about it, yeah, you should get tested. But, okay, now we're going to go on to syphilis. So, syphilis is caused by Treponema pallidum, which is actually, like, one of the most... This, to me, is, like, a very interesting bacteria. You know what? It's a spirochete. Wait, I think... No. Oh yeah, it is a spirochete. So, Treponema pallidum is a microaerophilic, so it can survive in like low levels of oxygen. Gram-negative spiral bacteria, which causes syphilis. And yaws. YAWS. I do not know enough about yaws, so I'm not going to talk about that, but I am going to talk about syphilis, like the STI. So, syphilis. What happens? The pathogenesis. This enters through your mucosal membranes or through abraded skin, and then it reproduces at the site of entry, which then leads to spreading to the regional lymph nodes, which then leads to it getting into systemic circulation, so like your whole body circulation, and then it gets into your other organs. And so, syphilis has two phases. So it has primary syphilis, then it has secondary syphilis, and then it has tertiary syphilis. Tertiary syphilis. So we're going to talk about primary syphilis. Primary syphilis, we're going to have like a chancre. What is a chancre? A chancre is going to be a painless mass. A painless little... Basically a weird, like, darkened pimple, which then becomes an ulcer at the site of, like, entry, which can be on, like, the shaft. If we're talking penor here, this is usually solitary, so we're only going to have one of those with a firm border. It doesn't have any, like, exudates unless, like, it becomes infected with, like, something else. And then there are spirochetes that are a shit ton of spirochetes inside of that little pimple, basically. Chancre is a hard word to explain, so I'm just going to use the word pimple for y'all. What was I looking at? So this is usually solitary, painless, and it heals without scarring. Secondary syphilis, though. This is going to happen in 2 to 10 weeks after like the chancre resolves in 75% of untreated patients, and this is due to systemic dissemination. So basically, the syphilis has spread to your body. It's spread to the rest of your body. It's spread to like the skin and your other parts of your skin and other mucous membranes. Any organ can be involved, and this will last for 2 to 6 weeks, and it's followed by an asymptomatic period of several years, in which spirochetes are just going to continue multiplying. So it's like you're not symptomatic, but you still have it, and you're going to keep having it until you fix it. By the way, you can treat syphilis with penicillin G and I think it's intramuscular injection. Am I right, Yude? Have you seen syphilis often in hospital? Have you seen syphilis in hospital or no? I haven't ever seen it. Okay, continuing. And 25% of patients that have the secondary syphilis are going to have a relapse of it. But the unlucky 1/3 will progress to tertiary syphilis. This is where we have rashes, where we have weird like warts that are 2 to 3 centimeters. They're elevated. They're not really warts. They're more like reddish brown plaques. I'm not going to show a picture of it. There could be follicular syphilis, which is where you have like small papular lesions on hair follicles, that will cause loss of hair. You can also have nummular syphilis, which is where you have coin-like lesions in the face and the perineum. Or you can have neurosyphilis. Syphilis in your brain. Oh my god, why am I so tired? Maddie, why am I so tired? Wait, no, for real, like, I don't...
What time? Isn't it like 3 a.m.?
No, it's only 1:17.
Oh my god.
It's only 1:17. It's not too bad. It could be worse. But also, so the most common presentation of syphilis is going to be... So there are 3 manifestations of syphilis, of tertiary syphilis. There can be cardiovascular syphilis, which is going to you're going to have like a tree barking in your heart, in your aorta. There's going to be syphilitic aneurysm in the aortic root and the arch. There's going to be aortic insufficiency. And there's going to be sparse like treponema. The treponemes, you're not going to be seeing them as much. But neurosyphilis, you can have asymptomatic neurosyphilis where you have no central nervous system like symptoms, but you're going to have it. You're going to have like a weird CSF. You're going to have weird cerebrospinal fluid. What the fuck does that mean? So you could have like increased white count. You could have elevated protein. And this is confirmed by like detection of antibodies in the CSF. You could also have meningovascular syphilis, which leads to cerebrovascular thrombosis, ischemia, vessel occlusion, and infarction in your brain.
Oh, that's so exciting.
We love this. Though the most common presentation in like tertiary syphilis is going to be a stroke in a relatively young adult involving the middle cerebral artery. You can also have this is what interested me like when I first studied syphilis in undergrad, because like I wrote my capstone on like neurosyphilis actually. Paretic neurosyphilis. This is going to be the insidious and progressive cognitive impairment associated with mood alterations that end in severe dementia. Meningeal lesions are associated with like brain, like the parenchymal damage. So basically, like the tissue, the functional tissue in your brain just gets damaged, particularly in the frontal lobe. So you're going to have loss of your neurons. You're going to have iron deposits happening. You're going to have like gliosis. Gliosis is basically... Gliosis is a... It's really hard for me to explain this because it's basically a non-specific reactive change of glial cells, which are like a supportive cell type in your brain, in response to damage to the nervous into like your CNS. And then you're gonna have hydrocephalus, and the cool thing is you can see like the spirochetes in your tissue, like in your brain. Though there's also benign tertiary syphilis, which to me is boring. Basically, you could have like gumas. Gumas are basically like, think gum, like chewing gum, like if you chew up gum, like white gum. These are going to be single or multiple rubbery white gray tumor-like masses, and they're going to be in the liver, the bones, and the testes. Though it can also occur in other organs like your skin, your mucous membrane, skin or the mucous membranes of your upper airway and mouth. Isn't it great? Though also, fun fact, you can also have, I already mentioned before, like way at the start, vertical transmission. You can have vertical transmission of STIs. So these infections can transfer from like mother to fetus. And so we have an example of this is congenital STI. This is going to be transmitted to the fetus by the mother with primary or secondary syphilis. Spirochetes can cross the placenta and infect the fetus from about like 14 weeks of gestation, and the risk of fetal infection increases with gestational age. The infection can lead to spontaneous abortion, late-term stillbirth, or death after delivery, or premature or term delivery of live infants who have obvious signs of the infection. Or, if you win the lottery, they're completely asymptomatic. Though the most common causes of fetal death in congenital syphilis are going to be placental infection and the reduction of blood flow to the fetus, because basically the fetus gets all of its nutrients and shit through the mother's blood, or through the blood, basically. So if you have no blood, fetus dies. Then we can also have infantile or early syphilis. This is going to happen in the first 2 years of life, and the manifestations are the result of active infection and inflammation. This is where we have rhinitis, mucus patches, and like a big rash, and osteochondritis or periostitis. So like you can have bone infections. Though tardive or late syphilis is going to happen over the first 2 decades. Basically, we're going to have weird shit going on. We could have malformation. So like basically, since congenital syphilis is gonna fuck up a lot of your develop. Oh my god, fine. So obviously we know that syphilis is going to mess up with a lot of your development in utero. What's gonna happen when like you have an infant that survives all these things? There's gonna be stigmata or like manifestations that show, yo, this baby is kind of fucked up, right? Y'all are getting what I'm meaning here?
Yeah.
And so there can be like saddle nose, which is where there's perforation of the bony portion of the nasal septum causing collapse of the bridge of the nose. There can be saber shins, where there's going to be anterior bowing of the legs. So like it's your shin. Your shin is supposed to be straight. Imagine instead your shins looked like a parentheses. That's saber shin. And then we also have Hutchinson's teeth, which is where we have peg-shaped upper incisors. And according to my notes, the parentheses is they're like screwdriver heads. There can also be eighth nerve deafness, optic nerve atrophy. There's also be mulberry molar. So like there's abnormalities in like enamel formation of your teeth. Or there could also be rogads, which are abnormal fine patterns of scarring in the lower part of the face in people who've had syphilis and were not treated. The main treatment is gonna be penicillin G. You can prevent all this by just having penicillin G. And like for cases where the patient is allergic to penicillin G, I'm pretty sure it's amoxicillin. I'm gonna check. Syphilis treatment and penicillin allergy. Okay, so. Oh wait, oh my god, I have the wall thingy. Okay, fair. They didn't really mention anything if they have like a penicillin allergy. So like, let me look. Okay, wait. Yune. Hey, Yune. Are you still here? Yune. What do you do? What do you do if you're allergic to penicillin and you still have syphilis?
You get fucked.
I mean, I'm pretty sure there's another way. Like, I know there's an alternative, but I forgot the name of the alternative. That's why I'm gonna ask Yune. Huh. Wow. I'm so eager. Fuck. But yeah. So, there's a lot of stuff. But like we went through basically all of it. We went through basically all the STIs that we went over in class. Congratulations, we did it. Now we're gonna go talk about fuck, what was I gonna talk about? Oh shit, right. What was I gonna talk about? I kind of forgot. Fuck, wait. Let me think about it. I do know I have like some special announcements. Firstly, starting today, I think I'm gonna start like promoting the fact that I'm gonna debut I Know Design and I Know Model on April 1. So I'm gonna start like I'm gonna start promoting that like pretty soon. Like all the a lot of posts are gonna be starting this week, I think.
Yes, King.
Yeah, I'm like trying to remember right now. I think that's number one. Number two, community. I didn't think about this initially because like low-key I kind of forgot that my birthday was coming up. So I have to change the schedule for Saturday on like the schedule picture. Basically, instead of Star Sand Island, we are going to be playing we're gonna be playing the Gardic phone, the picture drawing phone game. We're gonna be playing that on that day. So that's gonna be fun. And basically y'all are open to join. Y'all are welcome to join. And yes, it's gonna be on the debut is gonna be on April 1. I'm not even joking. There's no April Fool's joke here. That's real. That will really happen. I promise there are no jokes. I absolutely promise there will be no jokes with this. And what else am I missing? Oh right, there's gonna be something. I'm gonna be doing a yapping collab with Lev. Though my stream will still start at the same time. It's just that I'm gonna go even longer. Basically, like since her stream is gonna start at 2, I'm just gonna extend until 2 or until basically when her stream ends. That's gonna be what's happening that day. And tomorrow, I didn't really get through much, not gonna lie, but I will get through it soon. We are gonna go over like more pathology stuff plus some psych stuff in preparation for Wednesday. So like basically tomorrow, I don't like one of the reasons why I wasn't able to like show some of my notes is because A, it's very graphic, and B, my Notion hasn't been working today. It keeps saying I'm in offline mode even though I've closed it like multiple times, and then when I open it, it still says we can't connect. Has she? What did she say? I'm so scared. What did she say? Okay. Thank you, Lev. Thank you, Lev. I am so glad. She said no concussions, no horse electrolytes. You are not a horse. You guys are not horses. No horse electrolytes allowed. Oh! Oxidative stick land fermentation. I mean, that's not a fake Lev. That's Lev. Like, that's a real person. That's Lev. Lev is correct. And we agree with Lev. We agree with her. +2. Thank you, Lev. Thank you, Lev, for agreeing with me. No horse treats. No horse food. You are not a horse. You are people. Sucho was not literally the goat, though. Sucho was human. Sucho was like a real person. All of you guys are real people. No. He cannot. Sucho cannot eat. No. What the fuck? No. That is not allowed. That is not allowed. I do not allow this. No, I'm banning it. No horse treats allowed in here. Absolutely not allowed. But yeah, so my Notion wasn't working. So like that's partially why today's stream was like not as organized as I was hoping it would be. Because like I'm not usually, I mean, yeah, I actually am very much disorganized. This is what happens when I don't have like an external thing to organize myself with, like Notion. Or like, yeah, this is what happens. Everything devolves. But yeah, so there's that. But yeah, so honestly, I don't know why, but I'm really tired. Like,
Go bed.
yeah, I'm gonna go to bed. What's right out? Whomsteadiv is online. Whomsteadiv is online. Oh my god, wait. Zephyr's on! Let's go right out Zephyr. We're gonna go right out to Zephyr.
Bye.
Bye. I'm gonna go bed.
Yep, night night.
Good night, y'all. Wait, how do I